What you need to know about rabies symptoms in humans. Rabies is a viral infection that is transmitted from animals to humans through a bite or scratch. The virus targets the nervous system and can cause fatal inflammation of the brain and spinal cord. In this video, we will discuss the symptoms of rabies in humans, the causes of the disease, the diagnosis and treatment, and ways to prevent the infection. Symptoms of rabies in humans. The initial symptoms of rabies in humans are similar to the flu and may include fever, headache, and fatigue. As the disease progresses, the symptoms become more severe, and the patient may experience muscle weakness, convulsions, and difficulty breathing. The classic symptom of rabies is hydrophobia, which is an extreme fear of water caused by spasms in the throat muscles. Other symptoms may include excessive salivation, confusion, and hallucinations. Causes of rabies. Rabies is caused by a virus that is transmitted from animals to humans through a bite or scratch. The virus can be found in the saliva of infected animals, and the most common carriers of the virus are dogs, cats, bats, and wild animals. The virus targets the nervous system and can cause fatal inflammation of the brain and spinal cord. Diagnosis and treatment. Diagnosis of rabies is based on a physical examination, a medical history, and laboratory tests. A doctor will examine the patient for signs of the disease, such as muscle weakness, convulsions, and difficulty breathing. Blood tests and a spinal tap may be used to confirm the diagnosis. Once diagnosed, rabies can be treated with a series of injections, including a rabies immune globulin and a rabies vaccine. The earlier the treatment is administered, the more effective it will be in preventing the progression of the disease. Prevention of rabies. The best way to prevent rabies is to avoid contact with infected animals. If you are bitten or scratched by an animal, wash the wound thoroughly with soap and water and seek medical attention immediately. Vaccines are available for people who work with animals or are at high risk of exposure to rabies, such as veterinarians and animal control officers. Vaccinating pets is also an important measure in preventing the spread of rabies. Conclusion. Rabies is a serious viral infection that can be fatal if left untreated. The symptoms of rabies in humans can be mild at first, but can quickly progress to more severe symptoms such as convulsions, difficulty breathing, and hydrophobia. The disease is caused by a virus that is transmitted through the saliva of infected animals, and the best way to prevent rabies is to avoid contact with infected animals and to vaccinate pets. If you are bitten or scratched by an animal, seek medical attention immediately. Early diagnosis and treatment can be life-saving.